You're allowed.
Good morning, everyone. It is February 26th. It's Thursday. This is the Senate Health and Welfare Committee, and Senator Lyons is not here at the moment, but she will be soon. So we are going to go ahead and dive into our work while we await her return. And we're starting today with H 237. And we have legislative counsel here to take us through some changes and sort of quickly high level go over the bill with us.
Sure. Katie McGinn, Office of Legislative Counsel. Here is the latest draft of the bill. It's 2.1. And there are some changes that I believe the committee has already looked at, but let's run through them again. They're highlighted. So just to remind you where we are, this is the bill about prescribing by doctoral level psychologists. In section 1, we have a general definition section for the licensure of all psychologists, and then we're adding specific terms about collaborating practitioner, prescribing psychologist, prescriptive authority. In section 2, this is a section that governs the responsibilities of the board of psychologists, and there are some new responsibilities that the board would have, including some new language. So the board would have to regulate prescribing psychologist licenses pursuant to 3019, the next section, including the settings of clinical rotations, the minimum requirements for the curriculum of a postdoctoral psychopharmacological program, and also prescriptive authority, including the designation of conditions and drugs excluded from all authority, as well as requirements for prescribing particular drugs, and also to regulate collaborative practice agreements, again, pursuant to the next section, including collaborating practitioner qualifications and annual competency evaluations. And then section 3 adds a whole new section to the chapter in Title 26 on psychologists, and this is specific to doctoral level psychologist prescribing. So it creates a specialty. And we have language about the requirements to hold this specialty. One of the requirements is that the person has completed clinical rotations over a total of not less than 14 months and not less than 5 practice settings, to include psychiatry, geriatrics, family or internal medicine, emergency medicine, and neurology.
What was there before 5?
Let me look at it. Right, previous stuff. No, that's okay. It was higher.
Okay.
No.
But sounds like
Maybe
not.
not. Okay.
Okay.
Do you want to know what the other specialties were?
Sure.
Okay. It'll take me a minute. Everybody behind me, I know it. Okay, so it had been psychiatry, pediatrics, geriatrics, family medicine, internal medicine, emergency medicine, obstetrics, gynecology, surgery, and one elective.
Okay.
Yeah, thank you.
Okay.
Subsection C, we have the criteria necessary for prescribing medication. Language about the specialty by endorsement, and then there is a new report that the Senate would be adding. This report would come back to the policy committees from OPR on November 15th of 2032, and it would be specifically about the number of psychologists with a prescribing specialty pursuant to this new section, the status of available collaborative practitioners, and whether any updates to the qualifications of prescribing psychologists are necessary to expand access to care while also ensuring public protection. In terms of effective dates, the effective date section itself and section 2 of the bill, which is the board responsibilities, that takes effect this July. But then the actual prescribing by psychologists doesn't take effect until July 1, 2029. So that's 3 years out.
So OPR one chime in at all on this section, or
On the effective date section.
the effective dates and also just the report?
Jen Fuller, Office of Professional Regulation. The report sounds fine to us. And the effective date is July 1st, 2029. We had kind of requested to push it out a little bit, just because we're gonna have to do rulemaking. So, we appreciate having the time to be able to do that, to implement. Thank you. Thank you.
Great, does anyone have any comments for council or anyone in the room? No? Senator Cummings, you're good?
Yes.
Just
I
one
don't know if it's good with
question.
the bill, but
Okay,
Maybe you can go back to the section, as I recall. The psychologist has to consult with the physician before they're actually prescribing. Is that psychiatrist? My memory correct there?
yeah, pull the language back up. Okay, so if we have this section on the actual criteria for doing the prescribing, so there has to be a written agreement that all prescribing psychologists have to practice under a prescribing psychologist. And then having prescriptive authority by the prescribing practitioner and giving that to a prescribing psychologist is only to include the drugs for treatment of mental health conditions that the collaborating practitioner, meaning the psychiatrist, generally provides to patients in the normal course of their practice.
okay. No other questions or comments? We can, what would the committee like to do? We could take a break until Senator Cummings, sorry, Senator Ryan.
It's on
Till Senator Lyons gets back, or we can vote and then include her vote when she gets back. But either way, we're gonna have to take a break until.
Ready? Okay.
Okay, let's go ahead and take a vote then. You've got your sheet?
I do.
Okay. Well, first we have to have a motion.
Yes. I move that we change the go on reversal of the.
Do that.
That's not done before. I will make a motion that we forward the bill as stapled.
Thank you. Any discussion? Okay, seeing none, I will let the clerk call the roll.
Senator Benson,
Yes.
Senator Cummings,
Yeah.
Senator Goulart,
Yes.
Senator Morley. Yes. And you want to leave it open for Senator Lyons, or what do you want me to do?
Yeah, I think we
Okay,
should have the chair have to vote and include Callie.
Okay.
So, thank you.
thank you.
We, I'm just curious.
Yeah.
If we can ask this, I'm just curious, your
I'm just not ready to go there.
Okay.
I'm concerned about whether or not they have access to the complete medical records
Yeah.
that would allow them to know what all the other things I might be on. If they're not connected in with a mainstream hospital.
Yeah, I don't disagree with you on that at all. You know, I look at it too, though, on the sense I put it back into my own profession, that many people who do work under me, and then my stamp goes on it.
Yeah.
But I always review whatever they're doing, so I look at it from that aspect. If the individual already has the authority to oversee, then I'm relying on them to do their job, to be sure that they've done the oversight before they give the okay to prescribe. So that's how I
Yeah,
overcame
no, it can
that,
go either way.
that same concern.
This is H bills.
Yeah. Page 237. Great, thank you very much, Katie. And we will take a break until 9:30, which is our next round